Hey everybody, thanks for taking the time to join today. My name is Mark Keene and I'd like to welcome you to our first ever virtual Q&A session. We are very fortunate today to have Governor Mark Parkinson, the Chief Executive Officer of the American Healthcare Association, and Betsy Johnson, the President of the Kentucky Association of Healthcare Facilities and the Kentucky Center for Assisted Living, join us. I know you've both been incredibly busy, but thank you for taking the time today. How are things in the new normal?
Well, why don't I jump in, Betsy? I would say that running the association, it's been challenging, but every time I think about that, I think about the fact that it's like 1/10 of 1% of the challenges that the providers are facing in the buildings. And so I have absolutely no complaints, and we're kind of powering through it and hopefully getting some good results in DC.
Wonderful. Betsy, what are you seeing on the state front?
Exact same thing. You know, I feel for our members and what they're going through, what they're seeing day to day in their buildings. But I really want to take this opportunity to thank Mark and the HCA team for their leadership. I don't know how we would get through this without all the information that American Healthcare Association has provided to the state affiliates. We need that information, we use that information, we give it to our members, and I cannot thank you all enough for your leadership.
Oh, we're happy to be doing the work we're doing. Thank you.
Governor, I just thought I'd jump in and follow up on some previous comments that you've made publicly about nursing homes being forgotten. It's been a few weeks back now, but how was that message received, and what, if any, changes have you seen over this period of time with engagement on that at the national level?
Yeah, I mean, unfortunately, we really were forgotten the first couple of months of this whole virus. There were limited resources out there. I mean, first of all, it goes without saying this wasn't our fault. And it spread into our buildings, not because we had bad infection control or things that the critics would want to say. It spread in our buildings because asymptomatic people can have this virus. And that means that without testing and without equipment, there's absolutely no way to stop it. We were not a priority for either. We were treated like second-class citizens. Our residents were treated like third-class citizens, our staff even worse. And we see the results. We've been making a lot of noise about it, and I think we're now at the top of all the priority lists. So, things should be getting better on equipment and on testing, but there have been tragic results for what I think was a massive public health policy mistake, which was to put every resource the country had into hospitals, some of whom ended up seeing very, very few COVID patients, and completely ignoring us, which is where the battle is really taking place. A tragic and very poor decision, but it's being corrected now.
That's great to hear. Betsy, what are you seeing as the state's response to the COVID-19 pandemic?
Unfortunately, the same experience was in Kentucky. Again, hindsight's always 20/20, but our state response was more hospital focused. Our governor's gotten great marks on the way he's dealt with this for the community at large, but there was never, in my mind, a risk of there being a surge on our hospitals based on the data actually that American Healthcare shared with us, but they were so hospital focused. And as you know, we spent millions and millions of dollars building field hospitals. Meanwhile, our people didn't have that adequate personal protective equipment that they needed. And we still are lacking funding and support for our skilled nursing facilities. It is getting better. We are going to do widespread testing. It rolled out this week. But still, I still have members call me every day that cannot get basic supplies that they need, which is just tragic.
Governor, Leader McConnell's been very vocal about the need for COVID-19 immunity provisions in any future stimulus packages. How does AHCA see this playing out? Do you see that as a likely inclusion in future bills?
Well, first of all, I want to give Betsy and the Kentucky members a lot of credit for this. We would have absolutely no chance to get immunity at the federal level if it wasn't for McConnell. And I think McConnell's efforts were largely pushed by Betsy in the state association, that have been meeting with him and his staff and just saying, hey, this is incredibly important. And it's given us a shot. Normally, as I said before, there's no way you could get immunity through Congress because the Democrats are not going to approve it. It's just not going to happen. But what McConnell has done, he developed this position, I just think a day or two after Betsy and the folks down there met with him. is he said to the Democrats, if you don't give us immunity, we're not going to pass another stimulus bill. Now, if he holds true to that, and he's pretty stubborn, if he holds true to that, we got a real shot at immunity. So I don't want to overhype it, because you just never know what's going to happen in the legislative process. But they're going to pass another stimulus bill. That's what our lobbyists tell us. Probably not until right before July 4th recess. And if McConnell stands firm, we have a real shot at this. And we desperately need it. I mean, and no Kentucky member needs to be told that. You all know what a nightmare this is on the litigation side. So again, kudos to the state association there, and hopefully we can win this thing.
I echo your comments. I mean, Betsy and Bruce Linder, the entire Kentucky Association are just tremendous advocates for the industry. Betsy, kind of jumping off on that, I mean, the Commonwealth of Kentucky offers a lot of great things. An optimal legal environment for our industry might not be one of them. How do you see this playing out with over 60% of COVID-related deaths being in nursing homes?
I've told my staff that I think our job is just going to get harder after the pandemic, because I do see lawsuits in our future. Appreciate all Mark's leadership on the national level and encouraging Leader McConnell to get immunity done on the federal level. On the state level, our legislature did pass some language in Senate Bill 150, which was signed by our governor, but it's very limited, and the language, in my opinion, is clear as mud. So I'm afraid that's going to even cause more confusion. We did send a letter to Governor Andy Beshear with Leading Age of Kentucky and the Kentucky Senior Living Association asking for more immunity protections on the state level. But so far today, that letter's been unanswered.
Changing topics a little bit, Governor Parkinson, around this time of the year, the American Healthcare Association hosted congressional briefings. Obviously, we're not going to be able to do that in person this year, but it's always a great time where skilled nursing associations and their members can get together to communicate with their legislators. PCA Pharmacy is a founding member of the Senior Care Pharmacy Coalition. I have a sister company, Paragon Rehab, who is a huge advocate within NASL. Do you see an avenue where the different groups can band together to further articulate a broader message to our policymakers?
Yeah, absolutely. I mean, first of all, I hate that we're not having congressional briefing, and I look forward to seeing everybody in person here whenever that's possible. There's so many things that I think I took for granted before this crisis that I'll never take for granted again. And just frankly, to be around the providers in DC and have a drink and talk about what's going on, that seems like, winning the lottery at this point. I will tell you that the political and lobbying work that this sector has done for the last several decades, not just the time that I've been at ACA, but it has really made a massive difference. We're right now in the very finishing part of trying to get more money out of the Stimulus Act. I think we're going to get it. And it's because we have the ability through our members and their active political work to contact Secretary Azar from literally like almost every single Republican in Congress. And there's probably only maybe 10 associations in DC that can do that out of 6,000. And that's because of the long work that's been done, and it's really great. And so absolutely, we love working with our vendor partners on lobbying. It's something that's happened more in the last few years than it has happened before that. At Congressional Briefing now, it's not just providers. We're seeing a lot of the vendor community involved, and I would love for that to happen more in the future. So let's count on that for Congressional Briefing in June of 2021.
That sounds great. I mean, I think there's time for, on the vendor side or the operator side for us to compete, but there's times for us all to come together as one. And I think there's a lot of power in numbers, especially with the ripple effect that, especially this COVID-19 pandemic has had on all of our industries. So earlier this week, CMS put out some guidance about visitation to nursing homes. As you see states and economies begin to open back up, what guidance would you provide to family members who are anxious to see their loved ones?
We need to go really slow with it. The problem is that, as I said earlier, you can have no symptoms and have this virus. And there are, as we sit here and speak right now, it wouldn't surprise me at all if there were hundreds of thousands of people in the United States, maybe in the low millions, that either have or have had this virus and never knew it. It doesn't make sense until we come up with a vaccine to put that group of people together with our residents, when we know that when our residents get this, around 20% of them are going to die. They're not just going to get sick, they're going to die. And so I know it's really hard for the families. I get that. And it's hard for the residents. And we'll continue to try to come up with creative ways to get the residents and the families together. But this is a life and death thing. And so we need to go really slow, in my opinion.
Betsy, what are you hearing at the state level?
And I agree. We were very fortunate that Governor Beshear actually restricted visitors to skilled nursing facilities even before the federal the response to do so, which I thought was the right thing to do. We still support that. And as our economy is opening up, Governor Parkinson, you don't know, but this is our first week of trying some things. So on Friday, tomorrow, restaurants will be opening up. Monday, hairdressers. So I'm concerned, to tell you the truth, as we open it up, that our residents are going to be more at risk because, you know, we do have a workforce that goes out into the community, and they're going to be getting services, and they have every right to go to restaurants, and they have every right to get their hair cut. So it's going to be interesting to see how this plays out. But I agree with Mark. We need to take it slow and restrict visitors until the near future.
So I guess just wrapping up a little bit, it seems like in times of crisis, you know, it's an opportunity to see the best in people or the worst in people. You know, I think the nursing home industry, the assisted living industry has been a shining light of seeing the best in people. What are some things that have surprised you, even given that statement at the national level, and then Betsy at the state level?
If you look at what's happened to COVID around the world, it's hit nursing, it's hit elder care facilities all across the world. And in some parts of the world, when it's hit a building, it's just, the whole thing has collapsed. The staff have left, the administrators have left, the residents literally have been left just to die. That hasn't happened here. Instead of our people running away from the crisis, they've really run to it, you know, and I keep hearing stories about people that are quarantined because they're COVID positive, but don't want to leave their residence. I've heard stories of people working 60 days in a row, double shifts. There's even some stories of people living in buildings. Mm-hmm. And it's just unbelievable what our providers are doing out there. For them to get criticized the way they have in some parts of the press, it's just painful. But it's also just, their work is just inspiring. And I'm grateful. I really am. I mean, it sounds like a politics. I'm grateful to be in this job. I'm grateful to be able to fight for people that are doing what the providers are doing in their buildings. And I hope that we can deliver, because it's just what you all are doing is amazing.
And I agree. You know, I've always been inspired by my members. You know, obviously being a caregiver, long-term care is a calling, and they should be respected. It's amazing to me that my members reach out to me to make sure I'm okay. They're like, "Are you doing okay, Betsy? How are you holding up?" And I'm like, "I'm not doing what you're doing. I'm just trying to solve some problems." But that's the people that we represent. They're true caregivers, and they're supportive, and I couldn't be more proud of what they're doing. You know, we've lost 2 healthcare workers to COVID-19. The only 2 healthcare workers in Kentucky that have died from COVID-19 or worked in long-term care facilities. And it just amazes me that those people were showing up to work every day and being so brave, and unfortunately lost their lives. So I've always had respect for my members, but I definitely do after this experience.
Well, I can't thank you both enough for taking the time to join us and just kind of virtually catch up. To echo the governor's comments, I look forward when we can do it in person and grab a drink and catch up and come out the other end. So thank you. Have a wonderful day, and we certainly appreciate all that you both do for our industry.
Thank you.
Thanks, Mark. Good to be with everybody.